Psychosocial status of children with auditory processing disorder. Presentation by Melissa Avila. Introduction. Children with perceptual and communication difficulties like Central Auditory Processing Disorder, or APD, have an increase of psychosocial difficulties on top of already having language and learning disabilities. These psychosocial difficulties include emotional problems like decreased self-esteem and depression, behavioral and social issues like aggression and withdrawal, and learning difficulties like decreased academic attainment. Speech language pathologists and audiologists aim for the betterment of the quality of life of those with speech, language, voice, and other types of disorders and different degrees of hearing loss. Oftentimes, when talking about the quality of life, psychological and social health isn't really talked about when it comes to the people with these disorders. It, to some degree, makes sense because speech language pathologists and audiologists aren't trained psychologists, but the psychosocial effects these disorders have on individuals is too great to not be talked about and studied, and this was the purpose of this study. Auditory processing disorder is classified as a neural defect that affects how the brain receives messages. Many people with APD exhibit difficulties understanding speech in a noisy environment. APD also affects learning, speech, and different types of languages like written and spoken language. In a previous study, however, children were given FM listening systems which seemed to help curb their depression, anxiety, and social issues. Evidently, untreated APD can lead to less and less communication, which eventually leads to social isolation and more depression. There needs to be more research regarding this topic to help audiologists and clinicians help these individuals improve management and their overall quality of life. Methods. Participants included 39 children between the ages of 9.5 to 17.8 years old. 19 of those children had been diagnosed as having APD. 20 of those children did not have APD and were gender and age matched with those who did. They also went through many strict tests and assessments for those who participated in the study, like pure tone air conduction hearing threshold better than 15 dB HL in both ears, a score greater than 90% on the monosyllabic WRT. They also all had to have ear canal volumes between 0.6 and 1.5 centimeters cubed. They also had to have average intelligence or above. The researchers were also strict on the volunteers not having any sign of ADD or ADHD. A child with APD can often have the same types of behavioral problems as a child with ADD. It's easy to see, however, that using the techniques appropriate for an ADD child will not be very effective with a child suffering from auditory processing issues, who can have very specific auditory skills needing to be developed. Specifics for children with APD. The children who had previously been diagnosed with having APD had to have scored 2 SDs below average for an ear on at least 2 different APD tests and procedures. These tests included the synthetic sentence identification, the staggered Spondiak word, the dichotic digits double pairs test, and the frequency pattern sequence test. Psychosocial assessment. These tests were used to assess the psychosocial status of the 39 children and the parents. The SSRS test gave the researcher information on negative and positive social behaviors on the children and their environment. The BASC2 test provided adaptive and maladaptive behaviors and emotions of the children. The COOPA assessment screens the quality of life of the children along with the psychic, social, and emotional dimensions. For this test, there are questions and illustratives the child must use to answer the question. 5 represents the greatest dysfunction, whereas 1 represents the least. For the COOPA screening, the parents were asked questions regarding their thoughts on their child's functionality. For the questionnaires, for those who didn't exhibit a dysfunction, they were given the option of taking the test on their own or it being read to them. Language assessment. Language screening for all volunteers was conducted using the CELF4 screening test, or the Clinical Evaluation of Language Fundamentals 4th edition. The normal participants who did not pass the CELF4 screening test were not included in the study and referred to a comprehensive language evaluation by a speech language pathologist. The APD volunteer group had the test administered if they initially were not presented with a language disorder. This CELF4 test tested comprehensive language evaluation. Results: psychosocial status. The researchers found that the volunteers with APD in the study had reported much more psychosocial difficulties than those who did not, and there were no differences between gender. The parents with children with APD also had higher reportings of their children having problems than the parents of the other group of volunteers. The statistical comparison compared to the participants to those who had none. Those with APD reported differences for the pain, schoolwork, emotional feelings, and self-esteem for the COOPA and all four categories in the BASC2 and a few categories in the SSRS. The parents also reported that their children, as they grew older, adopted more positive skills like communication skills and coping. The specifics are shown on the next slide. Here we see that for the group with APD, they reported lower physical fitness, health habits, and energy, and higher on everything else on the COOPA assessment, like pain, stress, and schoolwork. In the BASC2, the children with APD reported lower in school problems and internalizing problems, but higher on everything else like inattention/hyperactivity and personal adjustment. In the SSRS, they overall reported lower on all categories. The researchers realized that the parents also show a growth in concern for their child's decline in emotional and behavioral growth and on their schoolwork as well. Discussion. The researchers concluded to three major results in the study. 1. There have been more reports of health and emotional difficulties in children with APD. 2. Parents were aware of these reportings and have reported themselves that they noticed their kids exhibiting psychological and social problems. And finally, there were no differences in children with APD with or without language disorders. Weaknesses of the study. The researchers also realized that there were many limitations in the study. The COOPA limited the researchers' ability to use any child under 10 years old. Age and sex group were matched, but parental qualities were not, which the researchers felt could have changed the outcome of the parent reportings. Failure to consult teachers and fathers also could have changed the parental outcomes, which was another weakness of the study. Conclusion. The researchers conducted the study to further investigate the psychological and social aspects APD had on children. The tests used were the Dartmouth Primary Care Cooperative Information Project Charts for Adolescents, or the COOPA, the Behavioral Assessment for Children, 2nd edition, or the BASC2, and the Social Skills Rating System, or the SSRS. They conducted the study to not only have concrete analysis on APD's effects on quality of life, but also in hopes of raising awareness so that audiologists and clinicians in the future are made aware and can further improve quality of life. Overall, there were no previous published studies specifically addressing the psychosocial health of children with auditory processing disorders. This is important to note because hearing loss can diminish quality of life, and a significant decrease in psychological and social health needs to be closely looked at, and help should be administered. Hopefully, with more awareness, we can truly grasp the effect APD and other disorders have on all aspects of life.